Would you like one stab or two? Hello and welcome to this edition of Urgent Bites, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and today I would like to raise the topic of digital anaesthesia. The ability to perform a ring block is a vital tool in urgent care, allowing for suturing of fingers, removal of foreign bodies, nail bed repairs, fracture and joint relocations, or for pre-hospital pain relief. It is by far the most commonly used regional block in urgent care, and it involves infiltration of anaesthetic down each side of the finger to form a ring that gets all four digital nerves. This is often called the double dorsal technique, and it is the one I have most often seen taught. But there's another technique used for digital anaesthesia that involves a single, volar, subcutaneous injection. Now this single volar injection is different to the transthecal digital block, and there is a link in the show notes to a YouTube clip that demonstrates it in practice. There is also a link to an article in Academic Life in Emergency Medicine that explains the technique. So have a look at the abstracts linked in the show notes, which are worth reading. The first is from the Journal of Emergency Medicine Australasia, published in 2016, and they looked at the double dorsal technique and compared it to the single volar injection by doing a randomized controlled trial. The next study is from the Journal of Plastic and Reconstruction Surgery in 2006, and was a randomized comparison of the two techniques, looking at administration pain and recipient preference. And the third study is from the Emergency Medicine Journal, who in 2010 did a single, blinded, prospective, randomized controlled, multi-center trial that compared patient satisfaction, anaesthetic effectiveness, and clinician satisfaction. The Australian study found that patients reported the same pain during both techniques and had the same effectiveness from both techniques. They conclude that the single approach is therefore a suitable alternative to the double dorsal technique. The Plastic and Reconstructive Surgery article, though, reported that whilst the injection pain was found to be the same, when asked which technique they would prefer, patients said the single injection. And the Emergency Medicine Journal study found the single injection to be as effective as the double, but interestingly, clinician satisfaction was better for the single injection. So have a look at these studies and the YouTube clip, and let us know if you have any experience in the single volar technique. It is important that urgent care physicians are able to adequately anaesthetise a digit, so whichever technique works for you is the best to use, but it might be that a needle-phobic patient responds better to a single jab, making having this approach in your armoury useful. Now, one point to remember though is the dorsal skin of the proximal phalanx will be missed in the single injection technique, so do bear that in mind. Now, as always, you can expect an urgent bite each Friday, leading up to the full podcast on the last Friday of the month. Please subscribe to the podcast if you have not already, and please share the podcast with all your medical contacts on social media. I look forward to seeing you all again next time, but for now, thanks for listening.